Hey everyone, super excited to have Malay Gandhi, who's the managing director for Rock Health, which is basically helps startups in the digital health space.
That's right. We fund and support startups working at the intersection of healthcare and technology.
So you guys are around everywhere. So you guys at CES, you have a wide area network, but I'd love to hear about your background first.
Sure. So I joined Rock Health about 2 years ago, starting with our third cohort of companies. And before that, I was working in consulting at Deloitte within their healthcare practice, so serving a lot of the pharmaceutical and payer industry focused on issues around consumerism, healthcare reform, and changing care delivery models.
So early stage investing, malaise, almost like gambling. What happened on stage, and where are the bets being placed now? I'm sure everybody'd love to hear that.
So we're seeing a lot of very large bets being placed these days. The average deal size increased by almost 33% year over year. So we're definitely seeing the bets being increased. I would say some of the trends that we're seeing behind that are really some of the ones we see in tech as well. So analytics and big data continues to be a hot area. One of the more reform-driven ones from coming off of the Affordable Care Act is really around population health management. So we're seeing these enormous platform companies come in to work with hospitals, to work with health insurance companies to really help them manage the health of these populations.
So I actually have a question. I work at Fujifilm Sonosite, and we have a big hardware lab, and it looks really expensive to do hardware deals, but you're saying we're having a hardware renaissance now.
Yeah, I really think that we are. I mean, it's becoming so much quicker to rapidly prototype build devices. I mean, everyone's familiar with the idea of 3D printing now, but that didn't exist 2-3 years ago. You weren't 3D printing stuff, in your own office. And then getting things manufactured, you can do it here. There's manufacturing facilities all up and down this coast, even in Fremont, where you can get stuff manufactured locally. And then it's pretty easy to get stuff done in China as well. So one of our companies, Spire, we funded them a year ago. They started pre-orders, 2 days ago. They'll have product ready to ship by September and on shelves of stores like Apple by Christmas. So in a year and a half, they went from concept to product on shelves.
What are some of your favorite deals that you funded this year, and what's their trajectory?
So, overall, portfolio is doing pretty well. Trajectory feels good. I think some of the more recent investments that we've made, that we're excited about, Spire, I just mentioned, they launched yesterday, but some other companies that have upcoming launches, Thrive On, we funded them last year. They're doing mental health on demand, so really bringing the best of professional coaching to everybody. So you don't have to see a psychiatrist and go into the office, but you can really get connected with a licensed professional through a mobile app.
What early stage companies, take a lot of resource and time to put together. What are some tips and tricks you give to folks right now who are entering the space, and how do they engage with Rock Health?
So, I think the first way you can always engage with Rock Health is come meet with us. We host office hours about 10 hours each week to meet with any company that wants time with us. You'll meet with one of our EIRs or with our venture associate or with me or anybody else on the team. So first thing is come in, come see us, tell us what you're doing. And I think, for everybody who's trying to work in this space, it's a really, really challenging space to work in healthcare. And the best thing I really recommend is get into the community. There's so many founders who've done what you're trying to do. It might not be the exact problem, but it's highly likely they've talked to the same customers that you've tried to talk to, or they've faced the same problems that you've faced. They've had to deal with HIPAA. They've had to deal with the FDA. So come get engaged with the community. Don't try to build on your own, because you'll probably just end up spinning your wheels or wasting time that you could otherwise be spending building your product.
So it's rockhealth.com?
Yes, that's at rockhealth.com.
And what do you guys have coming next? What's on your horizon?
So the big thing coming up for us is our Health Innovation Summit. This is our fourth year holding an industry conference. It's a really inspirational day-and-a-half conference meant for the entire community. And then the other thing that's coming up really soon is our company Spire has launched their first wearable device called the Spire. And you can go on their website, spire.io, to pre-order yours now.
All right, so check out rockhealth.com, and thank you, Malay, for your time. Cheers.
Thanks a lot. Appreciate it.